Hi, Samara. Welcome. Thanks for coming today.
Thank you for inviting me.
Why don't you start by telling the students a little bit about who you are and what you do?
Okay, so I'm an athletic trainer. I primarily teach here at Ohio State, and I do some coverage still, and I had a lot of experience previously with youth sports and high school sports before moving to Ohio. So that's kind of an area that I'm a little bit more passionate about. I feel like it's an area where there's a great need for the introduction of care related to athletics.
Yeah.
So that's a little bit about what I feel strongly about.
Wonderful. And so tell us what you work with or have in the past and currently help supervise and work in the schools and are seeing lots of youth. What's your general age range of who you're seeing?
The majority of the students that I send out are at high schools. Some of them at a private school would also have middle school or even full K through 12.
Okay.
A couple places they're getting athletic trainers to work in middle schools as well. So sometimes they might just have that middle school age range.
Yeah.
So that's been interesting, different to just try and prepare students that this is not the same population that maybe you're familiar with. The majority of our students are transitioning off campus to high schools or middle schools after they've been on campus in college athletics. So it's a very different population.
So going from working with kind of young adults to adolescents and then even our pre-adolescents. And so your students who are out in these schools, as well as in your experience as an athletic trainer, what are some of the mental health issues or the issues you see those adolescents and those pre-teens experiencing? Because you guys spend a lot of time with those youth. Right,
a lot of time. And so it's a nice space because you get to spend an extended period of time and really get to know a group of people, maybe more so than other healthcare providers, because you don't have a fee for service and a limited amount of time that you're only allowed to work with them. So that's nice. You can probably develop a relationship over multiple years if the student doesn't switch schools. Some things that we see a lot is actually by high school, a lot of students already have some type of diagnosis that's related to mental illness and mental health. A lot of times there are a lot of students who don't have anything that's diagnosed, and a lot of things are presenting in that 13 to 15 age range. So that's when you're really recognizing some things starting to happen. I would say anxiety is something that starts much younger, like 6 or 7 is the age range usually where that's presenting. So by middle school or high school, you may have a population of students who have already been managing it with medication and different things for years by the time that you are introduced to them. Other things like behavioral disorders or depression, those things usually present a little later, and then you also have substance abuse issues that kind of start to appear a lot in that middle school age range. So again, trying to educate students, athletic training students, that hey, even though this person is young in a biological age, they may have been dealing with different types of health issues for a long time. And trying to manage it on their own, or have had, some type of professional intervention to manage a condition. So don't just think that they're young and we haven't gotten to that point yet.
Or it's just a typical adolescent thing that they're going through, the transitions of being a young person going through physical and emotional changes. Sometimes it's something else.
Right.
So for your youth that maybe haven't, been receiving care, or you see some of these things coming up, how do those things come up for you guys? Is it just being in that close personal space with them that you guys recognize things and reach out, or are they telling you things that kind of give you some indication they might need a little more support?
Yeah, it can be a combination of both of those things that may occur. Sometimes it's even a teammate that'll reach out and say, hey, I've noticed something is a little bit off with this person. I just want to let you know because they've been really strange, or they haven't been performing the way that they normally would. So sometimes you have that. A lot of student athletes, though, will not directly, indirectly, really try and be maybe a little bit more engaged and close to you, spend more time or make excuses sometimes to be around you a little bit more if they don't have a more serious injury where they have to come in frequently for, daily check-ins and to do rehab with you. So just trying to pick up on some small things. Is this person avoiding going to practice because they just don't want to play their sport anymore, or are they really trying to reach out to you and kind of confide some information?
Yeah. Are there some behaviors that are showing me that there's something that they're trying to tell me something, or that they're around in ways that you wouldn't expect? So both the withdrawal piece and the being more present.
Right.
So when a youth does come to you, or when you get to have that conversation about either your concerns or that something is happening, what do you see as your role then, and what often happens? How are you reaching out, or how are you initiating that conversation with them? Mm-hmm. And then when or if are you engaging the caregivers? So
yeah, it really depends. Sometimes it's different based on school districts or the rules of the school. So they may already have some type of mental health plan in place that they want you to follow. Sometimes you have to try and develop that on your own in conjunction with the principal, with the team physician, with nurses, with school psychologists. So there are usually multiple people that you can kind of collaborate with to make a plan or put a plan in place. So typically our role is going to be to listen first, to make sure that we ask open-ended questions, really look for any unusual behaviors or just something that's out of character for that individual, which is also nice to have that relationship that you kind of know how that person normally engages. Yeah. Also understanding that student athletes in a high school or middle school age, it might be the first time that they are in more formal athletics, that's a lot more structured, that's connected to academics. So they have a different level of pressure and stress that might present, and some unique challenges as they try and progress from a lower level to a higher level. So all of those things can kind of present as some unusual behaviors as well. So you want to really try to monitor, because that group is kind of fragile. Yeah. In addition to, bullying that's happening in high schools and middle schools and everything else that they're already dealing with. And then maybe they've already had previous, traumatic events in their lives. Different issues with different health determinants that they might be struggling with, or their family might be struggling with. So you have a lot of outside things, and then you're adding on competition athletics and all these expectations on top. Also, if they get injured. So that's a huge factor that could also be a triggering event that you want to just be more attentive to what might be going on. So in those situations, definitely listening to what they're saying, trying to prompt and ask more open-ended questions. If you're concerned about something that's more serious, maybe suicide, being direct about that, because usually that's more helpful than trying to beat around the bush with those types of situations. And also, if you notice or somebody reports something that might be a violation in the school code of conduct, that, hey, I've heard about this, I have to report this type of information, but this is why, we're really trying to protect you, and make sure that you get the help that you need. So sometimes you can kind of use those policies and rules to help support what you're doing, and then try and refer that person as soon as you can, and keep in contact with not only them, but usually the coaches might have questions, and obviously it's a healthcare concern. It's private information, so you would have to get approval from their parents to be able to share anything like that, or just encouraging coaches and other people, hey, reach out to that person if you have some specific questions, because those are certain things that you can't disclose. Yeah. But really knowing the chain of command and what your options are, and even what the referral structure is. A lot of times athletic trainers might not work for the school district. They may work for a hospital system or a local clinic, and so they might have something in place for their referral procedures, and so that makes it a little easier. But then you have to think of other things that might be barriers for a high school student. You know, transportation, time. You know, do they have health care, any type of coverage? And is that a barrier? Cost being a barrier? So there's a lot of other things that can come in. So just really trying to have a plan in-house and some things that you can do at the school is really helpful. But, you know, in those more serious cases, you definitely want to refer them out.
So you sound like you have a lot of experience being part of these collaborative teams or having those conversations with youth, and then even probably having some of those conversations with the students that you guys send out to work with those youth. So, you know, if you were to give, you know, or to say one thing that you think is probably one of the most important things in your role or in your perspective, what do you think is one of the most important things to helping support the mental health of adolescents?
Education is a big piece of it, especially to try and decrease any stigma around it. I think there have been a lot of national campaigns with professional athletes that have really helped. I think exposure as well with just throughout the media with actors and celebrities and musicians that have all come out and say, hey, this is a real thing. This is not something that you should ignore. You know, it doesn't mean anything is wrong with you. You know, it's just part of your health that you need to take care of. Just like you would take care of a headache or an ankle injury, you have to take care of your mental health as well. So I think that movement is really helpful, and to just really encourage that, encourage appropriate language, not calling people crazy as a joke, you know, because it's so easy to slip into those things, and that's been normalized in a high school or, you know, a middle school setting. Also thinking of intersections of other things that you want to make sure that the student is educated about. Hey, not only are you just trying to be a high school student, you're also trying to be a student athlete, and maybe you have a strong identity to being a student athlete, and that defines who you are. So outside of that, you really haven't dived into your identity yet and really become, you know, the person that you're going to be. But there's more to life than just, you know, athletics. And if you get injured, you know, that could be a huge issue for someone and a huge trigger for them. So that's usually something that we try and talk about and make sure I educate the students on as they go out in the field that, hey, you're not with a young adult. And so they haven't, you know, maybe there are certain other things even about their identity, sexual orientation that they haven't disclosed to people and they might be struggling with. So it could be a lot of other things that are contributing to what you're seeing. So educating that it's okay. We can get you help. We want to get you help. We want to make sure that the whole person is okay and healthy, not just can you perform on the field.
So kind of looking at those youth as who they are in the context of their time and development in the athletic environment, but also beyond it. So just thinking of that broad sense of support. So.
Because it's so easy for them to have tunnel vision because that's all they know at that point. Maybe that's how they're recognized, you know, throughout school, and especially if they're really good at athletics, you have that extra pressure of, well, maybe this will help me get into college or to the next level. So I really need to stay and be the best, and anything else that might be associated with specific sports that add an extra level of concern. So. It's definitely something. Education is going to be the biggest thing, and not just for student athletes, the culture within, you know, certain teams. So talking to the coaches about it and saying, hey, we got to make sure that we are normalizing that it's okay to ask for help. You don't want it to be, well, don't go over and talk to the athletic trainer because they're just going to keep you out. No, we need to take care of, you know, the person who's in need. Parents as well. Usually they'll have parent meetings or coaches meetings at the very beginning of a school year. So making sure you talk about that in addition to dehydration, in addition to concussions, if you notice things or if you're concerned, these are also things that we're going to be looking out for. So the education piece is huge.
So being the advocate for that youth, that family, but and an advocate for creating a space for youth to feel like they can go to people and that someone is going to be there to receive them.
Yeah, definitely.
Well, thank you so much for sharing
You're
all
welcome.
of your great insights.
No problem.